Hi everyone, thank you so much for tuning in to our expert series. My name is Dr. Rashmi Roy. I'm a senior surgeon here at the Clayman Thyroid Center at the Hospital for Endocrine Surgery. So today we're going to answer your questions from social media, and I'm so excited to be here as your expert. So let's get into those questions. Can a benign thyroid nodule become cancerous? So that's a great question. So 95% of thyroid nodules are benign, which is a good statistic to know so that if you are diagnosed with a thyroid nodule, you don't have to panic right away. But certain nodules, they do need to get biopsied if they have certain suspicious characteristics on ultrasound or if they're larger in size. If you do get a benign nodules usually do stay benign. Now that is not true 100% of the time. Nothing in medicine is 100%. If you have a nodule and it's a centimeter or larger and it is biopsied as benign, it still needs to be monitored with yearly ultrasounds, maybe an ultrasound every 12 to 18 months, just to make sure that nothing is changing in size or characteristics. You may need a repeat biopsy if anything changes, but for the most part, benign nodules will stay benign, with a small percentage of them becoming suspicious in the future or even into cancer, which is why you need constant surveillance. If I have thyroid cancer, does my whole thyroid need to be removed? So this is a great question, and I get asked this all the time, and it is a super important question to ask your surgeon because the answer is definitively no. So we here at the Clayman Thyroid Center can cure your thyroid cancer potentially with a 99.8% cure rate by removing half your thyroid gland. And the reason why we're able to do that is because we do something very special here. We routinely remove the lymph nodes behind that side of the thyroid gland. So if you have a nodule that's on the right side of your thyroid gland, we would remove the right side of your thyroid gland along with the lymph nodes behind the right side of your thyroid gland. Those lymph nodes are actually the most important part of the operation because they tell us the biology of your tumor. And if those lymph nodes are not involved with thyroid cancer, or even if they're just microscopically involved with thyroid cancer, you are done and you're cured of your thyroid cancer by removing that half of your thyroid gland because we've removed those lymph nodes. If we left those lymph nodes intact and there was microscopic cancer cells in those lymph nodes, we would have no idea. And that's when thyroid cancer persists and you need second and third operations in the future. Because we clean out that whole side and we know the extent of your cancer, we know that we've definitively cured you by taking out half your thyroid. Now, if those lymph nodes are significantly involved with thyroid cancer and we do that intraoperative pathology during your operation, we find those results out while you're being operated on. If those lymph nodes are significantly involved, then we know we have to take out your whole thyroid gland. And we do it during that same operation. So there's no second operation. We do whatever we need to do to cure you of your thyroid cancer, but we don't do anything unnecessarily. Our preference is to try to save your thyroid gland or half of your thyroid gland because we think that's more beneficial for you postoperatively. It's natural thyroid hormone for you. Hopefully you won't need to have any or need any thyroid medication after surgery if we're able to save half your thyroid. So if you have a thyroid cancer diagnosis and someone tells you that you need your whole thyroid out from the get-go, please get a second opinion. I have a confirmed goiter with many symptoms, but I have normal blood work. Does this mean that I have nothing to worry about? So absolutely not. So thyroid function and having a thyroid goiter do not go hand in hand. You can have normal thyroid function and have a large thyroid goiter. You can be hypothyroid, meaning that you have low thyroid function and have a thyroid goiter. You can even be hyperthyroid and have high thyroid function and have a thyroid goiter. So thyroid function and having a thyroid goiter do not go hand in hand. Just because you have normal blood work does not mean that your thyroid goiter is nothing to worry about. The thyroid goiter means that you have an enlarged thyroid gland, and this patient is clearly having symptoms. So the symptoms that are caused by a thyroid goiter are what we call compressive symptoms. It's a large mass compressing on the structures in your neck, your windpipe, your esophagus, which is your swallowing tube, the nerves that go to your voice box. So all of these symptoms, trouble swallowing, trouble breathing, tightness in your neck, chronic coughing, voice changes, those are all compressive symptoms or symptoms caused by the thyroid goiter pushing on these structures. Those are all indications for surgery. The natural history of these thyroid goiters is that if you don't remove them, they'll continue to grow. They can grow outward in your neck, they can even grow below your collarbone into your chest. So just because you have normal thyroid function labs, do not dismiss your goiter. You definitely need an expert evaluation and likely expert surgical management. What is the process of becoming a patient, and what if I don't live in Florida? So these are great questions. So you do not need a referral to become one of our patients. You can find us online at thyroidcancer.com. When you get to our website, there's a tab that says Become a New Patient. Once you click that tab, you fill out all the information, and then your first contact or one of your first contacts will actually be with one of us. Myself, Dr. Clayman, Dr. Walsh, or Dr. So. One of the surgeons will actually contact you and go over what your history is, what your exams are, and what your potential surgical plan will be. So all you need to do is become a new patient on our website, and then our office will contact you and one of the surgeons will contact you as well. If you do not live in Florida, that's okay. Almost 40% of our patients are out of state and international, and we take care of patients that are not local all the time. So one of the biggest questions is, do I need to make multiple trips here? Absolutely not. If you're out of state, if you're international, we can take care of everything that you need from your evaluation to your surgery in one visit. So essentially how that works is you would come in, you would have your expert evaluation, which is your ultrasound, a laryngoscopy, which is a camera that looks at your vocal cords, a physical exam, conversation with us, going over your surgical plan in the morning, and then your surgery would be that afternoon or the following day, just depending on how you schedule it. So there's no need to make multiple trips here. We can certainly take care of you in the most convenient way possible for you. So just find us online, become a new patient, and we'll be happy to care for you. What is recovery like after thyroid surgery? So recovery after thyroid surgery is pretty quick. Immediately after surgery, you're going to be talking and eating. There's no restrictions on diet. The first thing you're going to remember when you wake up from surgery is an ice pack on your neck. That's something that we really stress. We want you to do for 3 days for as much as you can tolerate. After surgery, as far as showering, you can essentially shower 24 hours after surgery like normal. If there is a drainage tube that we leave behind, the showering would be 24 hours after the drain comes out. As far as activity, you can resume all activity, meaning cardio activity or cardio exercise after 48 hours, walking, biking, jogging. Our biggest restriction is just no heavy lifting for 3 weeks. So that's nothing over 3 pounds for 3 weeks. But patients that are in school, that are working, I usually tell them just to be safe to take a week off of school or work. Many of our patients actually go back to school or work earlier than that. A bigger question people ask is, what about driving? Driving, we leave up to you a little bit. You need to be able to quickly turn your neck so that you can look into your blind spot, obviously, and that you're not taking any narcotics. The majority of our patients don't take any narcotics after surgery, so really it usually takes about 2 or 3 days and you'll be able to drive again. After about a week from your thyroid surgery operation, you're about 85% recovered from your surgery. So the recovery is pretty quick, except for the weight restriction that we don't want you lifting anything heavy for 3 weeks. Thank you so much for joining us today for our expert series. That's all we have time for today. But if you have any questions for our next show, then please leave the comments below and I'll be happy to answer them. For any questions thyroid related, please visit us at thyroidcancer.com, and you could visit my YouTube channel at Goiter Guru. See you next time.